Bob's been delivering the mail in Philadelphia for over 35 years, but he's developed osteoarthritis in his hip, and the pain has become unbearable. With some reluctance, he went to visit Dr. Anderson, an orthopedic surgeon who specializes in joint replacement. They had a good conversation, and for the first time, Bob began to really understand why he's having so much trouble with his hip. After talking through the options, Bob decided to have hip replacement surgery. He's worried about the potential for complications, but confident that Dr. Anderson will take good care of him. Understanding his anxiety, Dr. Anderson asks Bob to keep in close communication with him using HealthLoop, a cloud-based platform that will help Bob prepare for and understand the process, while enabling Dr. Anderson to carefully monitor every step of his recovery. Before leaving the office, Nurse Emma gets Bob's email address so she can start him on a loop. This is a story about Bob and his journey with HealthLoop. When Bob gets home, he and his wife Linda open their email and read the first message from Dr. Anderson, who explains that HealthLoop will guide Bob through the next 90 days of his life and allow them to continue the conversations they started in the exam room today. During the first 2 weeks leading up to the surgery, Bob receives a series of confirmations through HealthLoop, helping him organize activities and check off all the to-dos. There's lots to keep track of, and Bob is glad to be reminded to submit his paperwork on time, to pick out a physical therapist, and to take care of practical things, like rolling up the throw rugs. HealthLoop even double-checks to ensure that he's stopped taking aspirin, which is good because he had forgotten and they might have canceled his surgery as it could put him at risk for post-operative bleeding. When the big day arrives, Bob and Linda feel well prepared and ready for the next phase of their journey. Bob's surgery is performed by a world-class team of surgeons in a state-of-the-art facility. The procedure is flawless. Once again, Dr. Anderson assures Bob that he will guide him through every step of the recovery, staying in close communication through HealthLoop. Arriving home, Bob is greeted with a message that contains all sorts of helpful information, such as how to position pillows for sleeping, how to change his bandages, and guidelines for taking a shower. This is all extremely helpful since the discharge instructions were rather overwhelming. On each subsequent day, Bob has a check-in with his doctor, which is easy because he doesn't have to remember any internet stuff. He just clicks the check-in button in the email and answers the questions that pop up on the screen. These daily touchpoints put Bob at ease. On day 6, he gets a question about swelling in his calf, and although it doesn't seem like a big deal, he's noticed just a little tenderness and swelling, so he answers yes. This triggers an important series of events. HealthLoop is simple on the surface, but underneath the hood, there's a powerful clinical analytics engine that processes patient responses in real time, identifying early warning patterns that are indicative of risk. Much like air traffic control, the HealthLoop dashboard equips the care team with a sophisticated set of instruments that track flight patterns, preempt turbulence, and engage patients as co-pilots to ensure a healthy landing. Back at the clinic, Jenny, the triage nurse, is reviewing the HealthLoop dashboard when she notices an urgent alert for Bob. The analytics engine has detected a pattern of early warning signs which could lead to a blood clot in the lung if unaddressed. Jenny is the air traffic controller. Instead of spending her day tied up on the phone, she monitors the entire patient panel and efficiently coordinates care. She does some follow-up messaging with Bob and then flags the loop for escalation to Dr. Anderson, who gets an immediate alert on his smartphone. Working from the hallway outside the OR, he's able to respond to all of his urgent notifications without skipping a beat. HealthLoop's automated tracking system enables Dr. Anderson to discover and avert potential complications that might otherwise go undetected until it's too late. The analytics dashboard is incredibly efficient, leveraging his time between surgeries to focus on patients who need him the most. As Bob continues through his recovery, HealthLoop seems to anticipate his every need and concern. At just the right time, HealthLoop offers guidance about important steps, like how to use a walker and how to decide when it's time to start driving again. And when it comes to questions, Bob is able to skip an afternoon of phone tag by messaging his doctor through HealthLoop to ask whether he's well enough to attend his grandson's first Little League game. As this journey comes to an end, Bob makes a full recovery and he's back in the yard playing with the kids. HealthLoop served as a compass for Bob, guiding him through this life-changing event without undue anxiety. It mitigated what might have been an awful chapter in his life and helped Bob feel in control every step of the way. Most importantly, he remained connected to the person who he entrusted with his health and well-being. And in that sense, HealthLoop sustained Bob with the confidence of knowing that Dr. Anderson was right there with him every step of the way.